Good afternoon. For this afternoon, we will continue with the IMCI of the clerks. And then I have asked you to prepare some video clips or photos regarding gender issues so that we could jump off to our next topic for Thursday, which is reproductive health and women's issues. Okay. Um, I have allowed share screen. Who would want to present first among the clerks? While we are waiting for others to join in, please start sharing your screen. I'll go first among the clerks.
Hi, Doc. Ako po. Rap kada po.
Sige.
नहीं कुछ है हमारा आज कुछ है हमारा आज
Doc, should I start na po ba? Or we're...
Go ahead.
Okay. So, good afternoon po, doctors. And this is my clinical case today. So, the patient data and medical history. Our patient is a 14-month-old boy living in Parañaque City and chief complaint of watery diarrhea. 4 days prior to consult, patient developed watery diarrhea and passed 3 watery stools. And 1 day prior to consult, the watery diarrhea worsened. Now the patient passed watery stools 5 times a day, and the patient became irritable and restless. On the ER, patient is still experiencing watery diarrhea, weak looking, and upon giving water, drinks eagerly po. So for physical examination, the height of the patient is 78 cm, weight of 11 kilograms, temperature of 37.3 degrees Celsius, restless and irritable, sunken eyes, thirsty, And skin pinch goes back slowly, like around 1.5 seconds approximate po. And for diagnostics, there's no blood in the stool exam. For the algorithm of our patient, so we already asked about the data of the patient. So the patient is experiencing watery diarrhea. So yes. Then the next for the algorithm, does the patient have the following symptoms? Like if yes, we ask for how long. And upon asking po, 2 days na yun, is there blood in the stool? There's none. And we need to look at the child's general condition as we did in the physical examination. Then the patient is not lethargic or unconscious, but the patient is restless and irritable as presented earlier. And we look to look for sunken eyes, which is seen in our patient, offer the child fluids, and the patient drinks eagerly, so he's thirsty. The skin pinch of the abdomen is low because it lasted for 1.5 seconds to return to normal. So we need to classify for the diarrhea now. So in this algorithm, uh, in this, the squared items are seen in our patients. So we classify our patient as having some dehydration. So the patient's irritable, restless, sunken eyes, drinks eagerly, skin pinch goes back slowly. So for the treatment of our patient, we need to give oral rehydration solution and continue breastfeeding. A child with some dehydration needs food pa rin po, even with some dehydration. And that's it po, Doc, for my theoretical case.
Okay, so what are your thoughts with regards to your case?
For case po, Doc, having watery diarrhea po, it needs prompt uh, examination po since yung we need to prevent the danger signs po like the unconsciousness po and lethargy of the patient.
Okay, so watery diarrhea, same with what we were able to discuss last week. So how will you apply the concept that you have learned last week through the report of the interns with regards to diarrhea?
Um, Diarrhea po, we need to classify po muna like yung hydration status po of the patient, like what we did in our case today.
Okay. So for example, your IMC, what IMC din yung iba, no? But in general, who is the IMCI made for?
For children po, for
Children.
ages,
And by who? Is it for medical practitioners primarily?
no po, Doc.
It is me. Who are we expecting to do your IMCI?
Everyone po in the healthcare facility po, Doc, should know it po.
Particularly,
The health workers po, mga barangay health workers po.
particularly the barangay health workers, your primary caregivers, such that in the health center, illnesses such as caused by diarrhea, would be able to treat and give initial management. Okay. If you would look at IMSI, it is not the full-scale treatment, but your um, ORS, hydration, etc., etc., and not so much so on treatment. Okay,
Yes, Doc.
so let's look at the other case. How many more cases do we have?
We have two more po, Doc.
Okay. Let's see the two more before we go into a full-blown discussion of your IMCI.
Okay, Doc.
Hello, Doc. Can you see my slide po?
Go ahead.
Good afternoon, doctors. Good afternoon, fellow clerks. My name is John Paulo Rocabo. I'm a local clerk, and this is my report regarding IMCI for cough. For my case, I have a 2-year-old boy brought to the health center by his mother for cough. His mother described that it started 2 days ago after they went to a family outing. His mother also said that a day before the cough, JB had episodes of sneezing and running nose. Now, what is the IMCI guidelines regarding cough? First, check for the danger signs. Um, for all sick children, ask the caregiver about the child's problem. Check for the general danger signs that would be not being able to drink or breastfed, vomits everything, convulsion, lethargic, or unconscious and convulsing. Then next would be, again, since in our case, cough is given, but if not, ask about for diarrhea, fever, ear problem, and check for malnutrition, anemia, immunization status, and other health problems. Going back to our case, we have a cough. So the next would be assessment of cough or the difficulty of breathing. Ask for how long a cough or difficult in breathing that lasts for more than 14 days may indicate tuberculosis, asthma, whooping cough, or other health problems. Next would be checking first if the patient is having fast breathing, a 2 months old or 12 months of age, fast breathing would be more than 50 breaths per minute, and more than 12 months to 5 years of age, fast breathing would be more than 40 breaths per minute. Next, check for chest indrawing. Chest indrawing occurs when the child needs to make a greater effort than normal to breathe in. You will look for chest indrawing when the child is when taking an inspiration. Next, check for stridor, a harsh noise made when a child breathes in. It occurs when the larynx, trachea, and epiglottis is swollen. These conditions are often called croup. This swelling interferes with air entering the lungs. If the swelling blocks the child's airway, it can be a life-threatening event. Then after assessing the cough, classify the cough if it's either cold or cough versus pneumonia or versus severe pneumonia or very severe disease. This would be the classification table provided by the IMCI guidelines for cough. The red labeled table would be refer to uh, uh, usually suggest referral urgently to hospital. Yellow would be managed as be treated in clinic. while the green ones would be recommended for home treatment. For, for a while. Uh, Hello po, Doc.
Go ahead.
Sorry for a while.
Ano nangyari?
Nag-error po yung sa ano ko slide. Wait lang
Ah,
po.
sige, reload.
Yes, hello po, Doc.
Yan, go ahead.
Um, Going back po, Doc. Again, red would be for referral urgently. This would have severe pneumonia or very severe disease, a child with cough or difficulty breathing, and any danger sign or stridor is classified having a severe pneumonia or very severe disease. The child may have another acute lower respiratory infection such as bronchiolitis, pertussis, or wheezing problem. A child classified as having severe pneumonia or very severe disease is seriously ill. He or she needs urgent referral to the hospital for treatment such as oxygen, bronchodilator, or injectable antibiotics. Next would be the yellow or for the pneumonia. A child with cough or difficulty of breathing who has fast breathing and or chest indrawing is classified as having pneumonia. This child should not have a general danger sign or stridor. A child with pneumonia needs treatment with oral amoxicillin for 5 days. We should begin this treatment in the clinic and it will continue at home. Later in, sorry, next would be the green or the cough or cold only. A child with cough or difficulty breathing, but none of the signs, the general danger signs, such as your chest indrawing, stridor, and fast breathing, is classified as cough or cold only. A child with cough or cold does not need antibiotic. Since antibiotic will not relieve the child's symptoms, then um, child with cold normally improves within 1 or 2 weeks. So now going back to my case scenario. Again, a 2-year-old boy is brought to the health center by his mother for cough. His mother described that it started 2 days ago after they went to a family outing. His mother also said that a day before the cough, JB had episodes of sneezing and running nose. Again, first check for the danger signs. That would be unable to feed, drink, or vomits everything, which are not present to our patient. Um, Next would be assessment of JB's cough or our patient's cough. Again, a patient has cough for 2 days, respiratory rate of 24 cycles per minute, no chest and drawing, no stridor, minimal wheezing. Next would be the classification of his cough. Since there is no sign of pneumonia, no signs of very severe disease, this is classified as cough or cold only. The management would be inhaled bronchodilator for 5 days, soothing remedies such as water, juice, or milk, looking out for the development and progression to fast or difficulty of breathing. If became present, return immediately to the health center. Then follow-up checkup would be 5 day after 5 days if it does not improve, if the patient didn't improve. Rather, that would be all for that.
You see that it's classified red, yellow, green. How would you correlate that with how we look at cough cases now that we have your COVID? Please show that,
Yes, sir.
yeah, that one.
Yes po, Doc. Since we are in the pandemic po, Doc, we usually start off with thinking the patient has a potential or a possible COVID patient po, Doc. So we usually go for RT-PCR po agad po, Doc.
Again. Why? When do we go for RT-PCR?
Since we're talking about cough po, Doc, symptomatic na po kasi yung patient. So we usually ask for or request for RT-PCR na din po, Doc. Especially if the patient has a family member or exposure to a COVID patient po, Doc.
For example, um, not all COVID positive we admit to the hospital. And how would this parallel with this red, yellow, and green?
If our patient does not present with um, um, fast breathing or chest indrawing, we usually or we doesn't have a danger sign po, Doc. We don't refer them to hospital po, Doc. We treat them and observe them in clinic or in home base po, Doc.
Okay, so you're green. It's like you're asymptomatic. What's recommended for asymptomatic? Just quarantine, etc. You're yellow with signs. You give your treatment, but it could be outpatient. Only the severe cases do we admit to your COVID. Okay, so with the advent of COVID and looks like it's here to stay, we could build on this CAF IMCI and incorporate um, our present recommendations for coronavirus. Since your cough and also for diarrhea and your other symptoms are encompassed and your IMC is symptom based and it will all fall under your IMC classification. So again, we have to adapt with current guidelines. So this MC was done pre-pandemic and we have to adjust. Okay? So again, it is for your barangay health workers, your primary caregivers. That's why it is simplified as such. Okay? Okay, let us have our last IMCI.
Ayan, good afternoon everyone. Can you see my slide po?
Go ahead. Lalo na ito,
Okay.
fever. Alright. Go ahead,
Apo.
Katie.
Okay po. Good afternoon, doctors and colleagues. So this is a case of a wait, ayan. This is a case of a 2-year-old girl residing in Batangas, presented at the OPD for fever of 2 days, accompanied by clear rhinorrhea. So this child appeared to be active. Her mother reports that the child does not have feeding difficulties and no history of measles within the last 3 months. Okay, a child with fever may have malaria, measles, or dengue. Yeah. Although dengue is not included in IMCI, it is important to include it in the differential diagnosis since the Philippines is a tropical country and dengue is also particularly common in patients who present with fever. So it is also important to ask the sick patient about fever. We also assess the child for additional signs related to fever. So the assessment for this child, wait lang po, ayaw lumipat ng screen ko, ayan. So we ask if the child has we ask for the danger signs. We ask for cough or any difficulty of breathing, any diarrhea. So these danger signs are, we use the acronym CUVA, which stands for convulsions, if the patient is unable to drink or breastfeed, if the patient vomits everything, and if he or she has abnormal sleep or abnormally sleepy, lethargic, or unconscious. Okay, now we ask if the patient has a fever by history or feels hot or a temperature of more than 37.5 degrees Celsius. Now we decide now the malaria risks. So it is important to ask if the child lives in a low or no malaria risk area. We may ask if the patient traveled outside this area, especially po in Palawan, which is a very high-risk area here in the Philippines within the last 2 weeks. We also ask if the patient had measles within the last months. So within the last 3 months. So the patient presented with no history of measles within the last 3 months. And then this can also have complications such as eye infection due to the complication of measles. Now we ask for stiff neck. We also assess for stiff neck to rule out meningitis, which should urge immediate treatment with antibiotics and referral to the hospital. In doing the assessment po of stiff neck, we should check if the child moves her neck easily as she looks around. So usually we can see this if the child cries or is in pain while trying to bend her neck, or if she refuses to move her neck altogether. Now we assess for runny nose. Since the patient presented with fever and runny nose, this may mean that she has a common cold or rhinitis. We should also ask the duration of the colds and if the patient lives in a low or no risk malaria area, she may not need an antimalarial, and the child's fever may be caused by the common cold. Now, we check for signs of measles. Although the patient reports no history of measles, we should check for generalized rash and for one of the following signs, which is generalized rash, cough, runny nose, and red eyes. Now, we also check for mouth ulcers. Now, we look at the oral cavity of the patient for any mouth ulcers. So, these are painful open sores on the side of the mouth and lips or at the tongue. So, this may be red or with white coating. They are severe if found deep or extensive. Now, if ulcers are present, the child may have difficulty of drinking or eating. Mouth ulcers are different from coptic spots, which are found inside the cheek of the patient during the early stages of measles. So, coptic spots are small, irregular, bright red spots with white spots in the middle. They do not interfere with drinking or eating. Next, we check for pus draining from the eye. So this may signify conjunctivitis. We can see crusting or pagmumuta from the eyelids. And when assessing, we should have clean hands and gently open the eyelids to assess for pus. Now we check for the clouding of the cornea. The normal cornea kasi should be clear and bright transparent. We should see the iris and the round pupil clearly at the middle. Now, when clouding is present, we can see that there is a little bit of hazy area in the cornea. Now, it's like a hazy glass of water with a little drop of milk. Ayan. So, we can check for corneal clouding, which can be due to deficiency in vitamin A. And if it is not treated immediately, this may cause ulceration and cause blindness. Now, immediate treatment with vitamin A should be given if present. Now we move on with the assessment for dengue hemorrhagic fever. Now, although this is not included in IMSI, again, we should always consider this because it is very common here in the Philippines. We check for bleeding from the nose or gums or in the vomitus or the patient's stool. We assess for abdominal pain, vomiting, and look for bleeding in the gums or nose, any petechiae, cold and clammy extremities, and slow capillary refill. Now, if the patient has a fever of more than 3 days, we do the tourniquet test. Okay. Ayan. So for the classification table, we have here high-risk malaria table. Now, we see here that in the very severe febrile disease, there is the presence of any general danger sign, which I said earlier, in the presence of stiff neck. Now, we consider malaria if the fever is present by history or the patient feels hot with a temperature of 37.5 degrees Celsius or above. However, we consider high-risk malaria only if the patient is residing in a high-risk malaria area. Now, next is the low-risk malaria and no travel history. Now, it is we can see here in the pink boxes, we can classify very severe febrile disease if the patient has any general danger sign or stiff neck. Next, we consider malaria if there is no runny nose, no measles, and no other cause of fever. However, we can classify naman fever, malaria unlikely if there is runny nose, measles, or if we can see other causes of fever. Now, next is the no malaria risk and no travel history classification table. Now, we can classify very severe febrile disease with any general danger sign and stiff neck, and fever, malaria unlikely if there is no general danger sign or no stiff neck, sorry. Okay. Next is the classification table for measles. Ayan. So we can classify severe complicated measles with any general danger sign, clouding of cornea, or deep or extensive mouth ulcers. Next is measles with eye or mouth complication. If we have seen on physical examination, pus draining from the eye or mouth ulcers. We can classify measles if there is a history of measles now or within the last 3 months. Okay, so for the salient features of the case, we have fever of 2 days with runny nose, no malaria risk, no travel history, no measles history within the past 3 months, no general danger signs, no signs of measles. Now, to classify fever, we should know that if the malaria risk is high, low, or no. We should also know if the patient has traveled outside the area in the last 2 weeks, then we select the appropriate classification table, which I showed earlier. So we now classify the patient as no malaria risk since she is residing in Batangas, which does not have malaria risk, and she also has no travel history. Yeah. So for the pertinence, we can classify the patient as fever, malaria unlikely, because she exhibited no general danger sign and no stiff neck. For that, we can give outpatient treatment. So for the management of this patient, we can give 1 dose of paracetamol in the clinic for high fever. Now, if she has a fever of 38.5 degrees Celsius or above, we can also advise the mother when to return immediately. She should follow up within 2 days if the fever persists, and if the fever is present every day for more than 7 days, we should refer for assessment. And that's all po for my report. Thank you.
So fever, very much before, it's the bread and butter of general practitioners clinics. You would have your medical certificates left and right complaining of the 3 diseases that you have mentioned. 3 symptoms, I mean, your diarrhea, your cough, your fever. Now, for the fear of being stigmatized of having COVID, no one would go to your clinic anymore to have a medical certificate issued for those reasons. And your fever would have, as Timmy has mentioned, a lot of different causes. Most unknown because this is non-specific. And of course, most important to rule out is that you are febrile because you have the newest virus in town. But again, you must not forget that there are a lot of causes of fever. Remember yesterday I had to do an errand to SM Bacoor. The infrared thermometer registered me 37.3. So what did they do? And I think because that's what their reaction was, they're used to people um, having high temperature because I was from the parking open space, right? So, ma'am, rest for a while. And then after resting and had the aircon of SM cool me off, lo and behold, I was already 36. So it was just because of the heat of the sun. You know that there's a heat wave here, 40s. Some provinces even experience 50s temperature, and it's very hot. Okay, so you have to be meticulous in looking at the possible causes of fever. Okay, most common would be urinary tract infection or a systemic viral illness, etc., etc. And again, you have to take note that this would be primarily your barangay health workers and your primary caregivers that would um, implement this IMCI. So it's more on first aid, as you have seen in the flow chart and the diagram on what to do when you encounter a patient with fever. If we're going to adapt this to your coronavirus, same way with what we did with cough. So if it's febrile, so this is automatic symptomatic because there would already be um, symptoms. So what would be the recommendation for fever during this time? How would you adapt or modify your tables, your flow chart to accommodate the presence of a virus such as COVID, as coronavirus?
Okay, Doc. So for if the patient has cough or any difficulty of breathing, we should first rule out if the cause of the cough is actually the virus. So in that case, if the patient has cough, he or she should be quarantined immediately and contact tracing should be done.
Okay, so one, contact tracing, and if ever really symptomatic and confirmed positive. Actually, even if you are just a probable, just having fever makes you a suspect, right? So
Yes.
once you have fever, once you have cough, you should quarantine yourself. And that's the problem. And that's the problem. Even if you know that you have symptoms, or even if you know that it's positive, because you are not feeling sick or it does not down you or it does not make you immobilize and you could still do your activities of daily living, you continue to do what you are doing. So, unlike, for example, let us change the symptoms. And that is why your coronavirus continues to be a spreader virus. So, for example, your coronavirus would have symptoms of when you are afflicted with your virus, uh, you become hemiplegic. So, it will affect your daily activities of daily living drastically, such that the spread would be what? The spread would be limited. And that is what makes your coronavirus and initially your flu vaccine very much fatal. Some years back, there was Ebola. What happened to Ebola? That's why it did not propagate that much. It was a fatal virus. But what happened to Ebola? What was the natural history of disease of Ebola compared to the natural history disease of your coronavirus, thus making coronavirus more propagating. Anyone? Ano yan?
Hindi ko sabi mo. Sabi ko ba silang dito yung kakain niya ganyan. Correct muna.
Walang ano, data.
Wala, naglang nila. Naglang nila lagyan nila. Hindi, lagyan natin dapat.
Anong konting data? Condense, wala.
Meron din po.
Hindi, ano na lang, asin. Anyone? Ebola eventually died down. What happened? Anyone. And you would have to look at virus as a host, how it propagates, to be able to differentiate the two and what happened to the two viral phenomena. Anyone from the international?
Doc,
Yes, Chin.
yes po, Doc. Sa pagkaintindi ko po, Doc, usually po, Doc, Ebola usually is about 2 to 21 days po, Doc, na bago magkaroon ata po ng symptoms. And hiwalay po siya, there is dry and wet symptoms po, Doc. Usually dry po nung una, then ayun, dry is usually fever, aches, and pains po. And then yung wet po, dun na po yung diarrhea and vomiting na po, Doc. And usually its symptom signs and symptoms for is fever, aches and pains po, and weak and fatigue. The usual signs of virus infection po, Doc. And ayun nga po, usually po kasi, Doc, it would eventually uh, lalabas for about 8 to 10 days po, Doc, and it could be treated symptomatically po, Doc. Compared po for the coronavirus po, Doc, it's spreads easily po, Doc, and then within 3 to 5 days po, lumalabas po yung symptoms niya po, Doc. And it could be infectious po yung patient, even if asymptomatic din po, Doc, yung patient. Tama po ako, Doc. Yun lang po pagkaintindi ko po.
Which is more fatal?
If for i-compare po sa timeline po, Doc, I think po, Doc, COVID is more fatal po if hindi po siya naagapan agad. But if Ebola po, Doc, in terms of severity, I think Ebola would be more fatal if hindi po siya nakita at binigyan ng proper medications po for the Ebola.
Hence, that's why Ebola eventually died down. Because what? It kills its host faster than your coronavirus, such that it could limit the spread and did not spread as fast. Your coronavirus spread so much fast because 80% would be asymptomatic, and therein lies the problem. So most would be asymptomatic, thinking that it's okay, and therefore spread it. So the ones who will suffer would be the ones who have a down immune system or would have comorbidities. That is what is happening right now. So our mobile young people continue on with their life, but they bring the virus to the people who are at home, those who are immunocompromised, and thereby propagating the problem. Okay? So we have to look at these three symptoms more closely, because your fever, your cough, and your diarrhea are all part of the symptoms of your coronavirus. Okay? So your IMCI, so this is just a complement of what we have discussed and specific cases, more specific cases on your IMCI. And we have discussed diarrhea and your pneumonia, your UTI as some of the disease illnesses that we commonly see. Okay? So any questions with regards to these symptoms and illnesses? So if there's none, so our next topic, we will be having reproductive health for our next topic. So we will have a reporting on reproductive health on Thursday. But now I have asked you for issues on gender issues that you may have come across. Could be personally or some things that you see on your portrayed in series or movies or images. So was anyone able to find to so that we may start off our discussion with such? Is it still an issue? Would gender still be an issue? Or is it a passe ideology being discriminated because of your gender, etc., etc.? Is it not a problem anymore?
Hello po, Doc. It's still a problem pa po, Doc, because for example, an issue for the in the medical field po, Doc, women surgeons versus men surgeons po, Doc. There comes across as in a study po, Doc, that patients prefer surgeons that are men and women are not really preferred po because there's a stereotype po, Doc, for women na for example in terms of decision making po, Doc, parang wish-wash po pagdating po daw ang mga women po in terms of decision compared to men po na straightforward. And uh, mas it's ano po, it's very common po for siguro in a layman po that if you say surgeon, it's actually a man's job, not a woman's job po.
Do you agree to that?
No po, Doc, usually. Kasi uh, ano po, becoming a surgeon po is a process po, Doc, and it requires skills po, Doc, and not only skills in just physically doing yung and pinag-aaralan din po, Doc, eh. Everyone studies the regardless of gender po, Doc. And the decision making po, Doc, it depends on how they study it well, how they assess the patient po. Not necessarily gender concentrated decision making or whatever po, Doc. There was an issue that I remember po, Doc, that there was a study or an issue that there are women who are surgeons po, but they are in bikinis po, because they were celebrating or something po, Doc. They called it that those women are disrespectful, unprofessional, or things like that po, Doc. But in ano po, there's parang stereotype, misogyny issues po about that po, Doc. And meron din pong parang uh, there was a hashtag #medbikini po, Doc, in support for the women surgeons po, Doc, because fairly they are not just doctors po but human beings that they could celebrate whatever they want, wear whatever they want, regardless of their professionalism po, Doc.
Okay, so like it or not, it's still evident in some specialties, particularly your surgical specialties such as your surgery, your orthopedics, etc., etc. So, but it's slowly um, being less, but um, still there are some old school that would still think that men are to have better surgery skills than what women would have. Okay. Other issues? Anyone else from our
Doc, can I share po?
internationals?
Ay,
Sige, sige. Go ahead
okay.
first. Then one or two internationals. I would want to have an example from India if they would have an example from their culture. Okay, go ahead.
Okay po. I would like to share po something that I wrote earlier habang nagla-lunch. So, kasi I have been thinking about this topic a long while na. So, yan. So, in the advent of overt misogyny and patriarchy, and I would define misogyny and patriarchy as hatred and prejudice against women. And it means that women are inferior to men. Patriarchy bestows that men should hold power and authority and that women should be excluded in it. I would tell you a little bit of a story about a 23-year-old woman who lives with her common law partner and his family. So this consists of his single father and his brothers. Now, one day, this woman showed with bruises on her arm and a little bit of bruises on her cheeks. And then, um, which are obviously a sign of abuse, diba? And then that day, her boyfriend was not home and she decided to put on ice on her bruises. Then at the kitchen, the boyfriend's father sees her putting ice on her arm. And she was silent. But the father asked what happened. She said that the boyfriend hit her. And the father did not respond and just went back to watching TV. Now, the boyfriend was never reprimanded and the abuse continued until one day she was subsequently hospitalized due to blunt head trauma, which almost took her life. So the problem in this situation po is the reaction of the father. So this is extreme patriarchy and misogyny. We can now relate this to the current political situation in the Philippines, that even the leaders of the country thinks that rape jokes, violent remarks, and discrimination of women are just small things and it should not be taken seriously. But no, these leaders, that's why they're called leaders kasi, because they lead by example. And do we want our young generation to think that way, that it is okay? So we should end this, and women are not only subordinates. We are not just for cooking men's favorite dishes. We don't deserve the discrimination and we should be given equal rights. We don't deserve the abuse. So ayun. Thank you po.
Your enabler in psychology, those are called I don't know if you've come across this flying monkeys. So these are the enablers of your abusers. So they are worse or sometimes even worse off than your perpetrators because they are the ones who what conspire to conceal, to save face, etc., etc. For example, you have this abusive person and just so happens that he or she comes from an influential family. So, of course, to save the name of the family, you would have your, um, in Filipino language, it's consentidora. Ano, could you help me in English for the international? Um, yeah, they are the enablers and allow these abusive behavior to propagate. And then it goes back to a culture wherein it is very permissive. Again, um, when there are drinking sessions, it's not it's so much common to talk about things like this. Okay lang kasi happy-happy, etc., etc. And there are things that our culture permits that, if come to think of it, should not be the scenario. And because it's become such considered the norm, even if it's wrong, it still propagates. And that is what we have to that's what we have to aim to more or less stop. Before we go deeper into these issues, may we hear from the Indians? How is it in your culture? Are there gender issues? I know there is a deeper issue for you guys, such as caste, but let us focus on your gender first. Gender issues. Anyone?
Yes, ma'am, there are gender issues in India. Can I share my screen?
Okay, share your screen.
Okay, I have made a sketch. Wait,
It's not showing yet.
yeah, wait. Now, can you see it?
Yeah, yeah, go ahead.
Okay. So that gender inequality India is there, and it is in form of many ways. But the most significant is the literacy rate that is affecting. Um, when we are talking about gender equality, most people don't like their girls to go to schools, or they don't want them to educate, and this reflects on the literacy rate of our country. According to a 2011 census of India, the overall rate of literacy is 73%. But when you break it up, the literacy rate for men is 80%, but for women, it is 64.6%. And this shows that how much women are affecting with this gender inequality. Think of it like a snake. There isn't gender equality. That's why women don't get education, and with no education there is gender inequality, a snake eating its own tail. And the inequality is there is so much that the government of India had to initiate a scheme and a campaign, Beti Bachao Beti Padhao, to generate awareness and improve the efficiency towards education for girls, and to target the population in the rural areas as well as in the metropolitan cities to educate girls. Now, when I studied in New Delhi, and I noticed the one thing that in my class, there are majority of boys students, and then there are girl students, but they are not in that much number. That's why when I came to the Philippines, first thing I noticed that there are more female students compared to male students, and there are more women professors. So this is affecting. Now if I ask everyone that if when you see these girls, which one do you think is educated? Of course and then this raises the question what education gives. Like if the girl is educated, if the person is educated, they can think for their health, they can think for their occupation, they can become independent in the society, and by becoming educated they can break the gender equality. But then there is gender equality. Now there is many reasons why there is gender equality. First, the parents are not educated themselves, so they think the girls are burdened. They will one day they will one cliche example is that one day they will get married, and they will go to someone else's home, they will be with their husband, so why bother to educate them? This is the main concern. If you go into the rural areas and ask why people are not educating girls, they will say this, that if the girl is going to live with her husband for the rest of her life, then what is the purpose of educating the girls? And by this, they are robbing the person to their basic needs, basic rights. The girls doesn't know what is good and bad for them, or what they can get in the society, what are their rights. And this leads on to the next generation. They also do the same for their children, and this becomes a cycle. And this is what is happening in India right now. And the gap and is so much that the government has started this scheme. So this is the sketch I tried to create to demonstrate it. Thank you.
Okay, so education literacy rate situation is the Philippines quite similar. So you are saying, well, as you are saying as a male that when you transferred here, are females treated better here than in India? Are you trying to say that?
No, no, not
Not
in that,
really.
but they are the most female students I can see in the class than in the campus than in India.
More students here than in
Yeah,
India?
more female students.
Okay. May I hear from the females? Any opinion from the girls? Indian girls?
Yes, doctor. Good afternoon to all.
Good afternoon.
Yes, doctor. So I would really like to emphasize
Hello,
on the fact that
hello.
gender in
Let us hear from and Edwin. Let her go ahead first before you talk. Okay, go ahead.
yes, doctor. I would really like to emphasize on the fact that the idea of gender inequality starts at home, because it's usually like in Indian families, this is how it is. When a female grows up and she's going to probably enter her early 20s, it is assumed that she is supposed to be responsible to carry out the household chores and start excelling in things like cooking and cleaning. And well, that's not what her parents built her up for. She has a lot of responsibilities that she wants to cover up. It's not just motherhood that she is looking for per se. She has a lot of dreams, like she wants to probably create a she dreamed to become a surgeon, lawyer, and wants to play an active role in the government, maybe. So I think that it is not just that in Indian families, per se, females are expected of certain qualities. Like if you do not know how to cook, how are you going to take care of your family? If you do not know how to deal with children, how will you be a good mother? Well, a woman is more than that. And I feel like it should really start at home. Even men, in Indian families, men should be encouraged to share works at home. Like it could be anything. You can clean, you can cook. It's the job of an individual rather than a gender-based responsibility. So I feel like it all starts at home. Once you start sharing things at home, you will also start respecting when you step out of home, and you will consider that all females do deserve an equal way they're respected even outside. So I feel like it starts from home, and that is how you can cultivate, change the norm that is being followed currently.
Okay. But you're one of the few, well, you being here and studying medicine means that you are better off than some girls back home. Okay, same way with our female students who have the opportunity to study as well, because even in the Philippines, they prioritize sending their male children to school. Well, that is for the lower socioeconomic class. Okay, but as you could see, still that divide is such that women, just by the merit of being women, would already be at a disadvantage. Okay, so even women at the upper class, just because that they are women, are also at the receiving end of abuse. Okay? There are, as Timmy has mentioned, that scenario could happen at any social class, correct?
Yes,
On
doctor.
experiencing abuse,
Yes,
and the
definitely.
parents will just, or the surroundings would just turn a blind eye. And who would these people turn to? Who could they go to?
Hold on.
Sorry, I forgot you. Edwin, you want to add something?
Yes, Doc. Doc, in this, when they speak of gender inequality, the thing here is what the society is supposed to understand is that there is a certain role, there is a certain role that a male should play in the family, and there is a certain role female should play in the family. I heard one of the students saying that the female, they are taught to cook, to prepare for the home, to take care of the kids and stuff like that. That is basically one of the role that female should play. Because for the male also have their own certain role that they have to play. Like the male, right from when they grow up, the male are taught to work hard. They are taught to work hard, to do the difficult job, to provide for the family, to provide for themselves. So I think this gender inequality stuff, it's something that I would say it's kind of biased, because in some country, like someone gave example that in India or in Philippines, the male are more educated. I will also tell you, in the Western countries, like in the US, the numbers of population going to school are the females. The people receiving more scholarships to study are the females. The people given more rights are the females in the Western countries. So it just depends on culture. So I don't see it. It just depends on culture, but to the way most people perceive it right now, they 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 act as if the female are being more maltreated, or they are not given they are given less attention in the society. I will tell you a scenario in the public. If you should see a man hit a woman in the public, there will be so many people that will come out and that will come out for the head of that lady. So many people will criticize that man or even try to beat the man up. But I tell you, the same scenario whereby you see a female eating a male several times, nobody's going to say anything. Nobody is going to come to the man's aid. So the thing about gender inequality, for me, I think it's very, very biased, because people, there are things that are expected of the male and there are things that are expected of the female. If everyone should play their own part, I think everything will be fine. Not when one side is fighting for superiority over the other. You will agree with me that the male are more stronger than the female. It is not a stereotype. So you don't expect female to be doing construction work, lifting heavy equipment. No, because men are stronger. That is when men take charge of some of these things. In regarding to works, some girls say that they pay male more than they pay the males more than the female. In that contrast, you are in the society, for example, in companies, the role in some companies, the role the male play. Women, there are stages whereby they get sick leaves, they get leaves for when they are pregnant and then stuff like that. And then the women, the most of the women in our society, they only care for themselves. But for the men, they try to work hard, not just for themselves, but also for the family, also for their wife, for their kids. So the thing about gender inequality, I think it's biased, because every video that I watch or when I hear ladies talk, they tend to criticize the men, which is not absolutely so. In terms of let me say home abuse, you can see a lady hit a man in his own, the husband, more than 10 times, the man will keep quiet. The wife will continue to trigger this man, continue to slap the man, hit the man will keep quiet, keep quiet. But once the man hits the woman just once, it's a problem. The woman will start shouting. They were like, "Oh, he's abusing me," and the stuff. The thing about the thing about this gender stuff is it's not actually inequality, but I think one side is trying to be superior over the other. That is just how I perceive it, though.
Okay, anyone who has a dissenting opinion? So every opinion is open here and we are hearing it. Anyone who wants to argue the argument of um, Clerk Olisineco? Well, I do agree that there are women who abuse men as well. But in general, you have mentioned culture. In some cultures, there are women who get favored. It happens also. But those are, I believe, outliers. In 100 cases, around 90% male would be the offenders, 10%. And these are not exact figures, these are just estimates. Okay, but
Doc,
those
Doc, let me add, Doc, let me add to that statement. While in most cases there are more numbers of male abusers, is because the male that get abused don't come out. We feel
yes,
weak.
I agree too that the
We
male
feel weak. Yeah, the male feel weak when they tell the public that I'm being abused by my wife. The male has to keep quiet, not because it doesn't happen. In every relationship, even in this country, I can see so many females hitting their boyfriend several times. Their boyfriend will keep quiet. It is not that it's not happening, it's actually happening. But in male, we feel weak if they speak out. There's a difference between something not happening and something happening, and then the male are keeping quiet. The male will not come out. It's something that is of shame for a man to come out and say, I'm being abused by my wife. So rather, the man will keep quiet. He wouldn't want to make it public.
That's not perfectly right.
yes,
I don't think there's any reason for a man to hold back what he feels. So if you're being abused by your wife, why don't you just come out and talk?
okay. It's a double standard. So one wants to become superior. You have female pushing for equality. But again, with anything that is not in moderation, that's what you are telling that some feminist movements want females to become superior. Okay. That's the one of the main arguments that you've been telling. And with that, I do not agree as well because what we are pushing for would be gender equality, equal opportunities for both. So, same way that women are asking for equality, it should also be equal as far as rights are concerned. So, when you overstep your rights, uh, gender for others, and then the purpose of the feminist movement becomes defeated, and that is sometimes what other feminist movements are pushing for. Case in point, the one that you've mentioned, if a man hits a woman, he'll definitely get ostracized for it. And if a woman hits a man, one, the males do not speak up. Second, the bystanders would just look at the man and etc. etc. Why is that so? You've mentioned also the answer. Because men anatomically are stronger. How many times would a woman have to hit a man? So this is not all because there are strong women as well. But in general, for the average woman, how many times does she have to hit a man to for the man to feel pain? And how many times does a man have to hit a woman for that woman to feel pain? This is just on the average. So it just takes once for the man. Maybe the woman may have hit him or his man 10 times, but the resulting force may be equal, but more hits for the woman. Okay? So, anatomically, we are different. We have to, that biological difference is one also of the main reasons why there is inequality in the first place. And come the feudal patriarchal ages of technology, it became more evident. So, and here we're talking about gender, but we're just talking about males and females, and we do not we're not even placing your LGBT community in the conversation yet. Okay, you see, so there's no right or wrong answer. Okay, anyone else who wants to agree or disagree with what has been said?
Doc, basically, Doc, in terms of equality or inequality, it's really just based on the rights of an individual po, regardless of gender po, whether you're a man, a woman, or part of the LGBT po, Doc. The reason why we have policies or um, laws about, for example, women discrimination, I mean LGBT discrimination, or policies about women and children or any pregnant or seniors is because they have special cases that is needed. For example, yun nga po, for the anatomical consequences, or you the patriarchal or misogyny ideologies po that is more prevalent than having equality amongst us po, Doc. So basically, yun lang po yung that's the is why we um, push this equality, not necessarily feminism that we women should dominate or men should dominate or the LGBT should dominate. It's more of having equal rights as individuals po, having equal opportunities, having um, not be discriminated against whatever dreams you have or whatever careers you're going to have, whether you want to have children, whether you want to have your careers, whether you have if you want to love whoever you want to love, Podok, as long as you have the equal rights, you're not
May love
giving
lang, no? Sige,
uh,
go ahead.
you and you're not necessarily giving harm to the society, Podok. Although these concepts, Podoks, are new, and usually those people who are used to have this misogyny or patriarchal mindset po, Doc. The world is changing naman po, Doc, and we are open to whatever views necessary to have a uh, better living, better humanity po, Doc.
Okay. You've mentioned policy. Okay. Um, how would policies be formed? Why is there need to make policies? And we have a lot of policies for pushing women's equal rights, children's equal rights, etc., etc. How does it form? How do we form policies?
Um, my opinion po, Doc, we form policies po, Doc, based on the needs and the needs of the certain individuals po, Doc. For example, if we have cases like abuse in our LGBT po, Doc, and they were not given voices, they were usually discriminated po, Doc, that they have been, for example, raped by a man. Supposed to be usually when we say rape, we say that a man would penetrate the woman, usually biologically though. Pero but we don't see every day that there are women of trans women or gays po Doc, who are raped by men or women po Doc, in cases po Doc. So we usually do policies po Doc to have individual rights and justice po Doc, especially to those people of in yung mga individuals, yung mga not special, but yung people na sila po yung LGBT and not necessarily represented usually po Doc, by an ordinary individual.
So your policy would surface because there is an existing problem, there is an unmet need for certain things. So, for example, the University Philippines, that's the National University of the Philippines, had a policy with regards to medical admission. Circa early 1900s, the policy was because they were observing that there were more males than females going into university. So they made a policy that out of 160 slots of students, they said that 80% should be male, 80% should be female. Okay. So that was the policy because they saw that there were few women being admitted. Okay. So what happened? It was equalized, but it was generally before, it was easier for a woman, even with not competitive grades, to get into medical school. Year 2000, the policy is still in place. And what would be the observation? They say that it is easier for a male to get into College of Medicine of the university because women in general have higher grades than males during undergrad. So a policy that was originally intended to help the females now are kind of at a disadvantage because for you to get into medical school, you have to get a higher grade. So your policy is usually a response to what was seen and what is needed. Hence, a policy was needed to put into play. Hence, a lot of your Magna Carta for women, your women's rights, etc., legislation with regards to rape, etc., and other policies for that matter, are in response to real life scenarios that we have experienced, and as such, um, so that we could more or less level the playing field or equalize things. Okay? Any other opinion from
Doc,
yes. Okay.
I have something to add with regarding to policy.
Okay.
The thing about policy is that we are all human beings, and human beings are not perfect. No matter how hard our leaders try to make policies, humans try to take advantage and exploit those policies, making those policies become irrelevant. So one thing is giving policies, but the thing is there are people who will always be there to exploit those policies. Like let me take for example, you give rights. Let me use this rights of paying child support. Like the payment of child support was supposed to assist the ladies and the kid, because some men would not want to take care of their family, which is a very good policy that they came up with. But what do we see nowadays? We see nowadays that there are more women and more women whom use this as a business. They have several kids with different men, forcing the men to pay child support up to thousands of dollars to millions of dollars. So when the government is trying to make policies to help the people, there are still those that try to exploit these policies and put a loophole in the policies that make the policies become irrelevant. So it's really difficult. For me, once a policy is being made, if it's no longer ineffective, or if it's affecting another gender, if it has not done harm to other gender, then they should just try to scrap that policy and reform the policy. We human beings should be welcome to change. As the world goes on, things are changing, and we should always change our policy with regarding to how things are going, Doc.
So would you rather not have any policy? So that would create anarchy if there would not be any law. Yes, none is not perfect. Aristotle, etc., and your other philosophers have already stated that long before. But as early as your early civilizations, your policies has had to be established primarily for reasons that man is not perfect. Even if your lawmakers are not perfect, you still have to have guidelines and basic to act as your basic guide on how to act on things. So if there would not be any policy at all, what would happen? If you would rather that no laws to abide to, etc., etc.
Yeah, my point is my point is there should be policies. There should always be policies, but these policies should always be updated. If the policy no longer serves its purpose, it should be abandoned and updated, because we human beings are changing. So we shouldn't stick to one policy forever. If the policy is no longer effective, or the policy has been undermined, then it should be changed.
Yes, I agree with that. Of course, if it does not serve its purpose anymore, then what would that policy be for? Okay, as I've mentioned, the one that was initially done one century ago may not be applicable anymore because of certain things. But then again, it is for the males to have equal representation for us for the medical school. So before, if it benefits females more, when the policy was made, now after 100 years, I am saying that it is still relevant because we are still asking for equal representation of medical students, equals males and females, but are now benefiting your male students more than the females, which were it was originally intended for. Okay? And some policies may eventually become irrelevant. I agree with that. For example, offhand, what could I think of? For example, policies with regards to, um, for example, you will make policies with regards to abortion or population control, for example. We go to China. What's the problem with China right now? Their population pyramid, because of the one-child policy and your family planning policies, their population is becoming like Japan and other European countries, wherein it's an inverted pyramid wherein the young one, their population's getting old. So I agree, if the policy is not serving its purpose anymore, we may remove the family control policy, your one child policy, so that um, it could again address the needs. Again, we go back. We always reassess the needs of a situation. That's why in any program planning that we have discussed in your third year, there any program, you implement it, then you monitor it, and we evaluate it. Same way with policy, it's a never-ending cycle. We do those four things to look if it is still relevant and it is still worthwhile to continue. Okay? But I do agree on you on that part that we have to update ourselves with regards to how effective and how relevant our policy still is. Policy still is. Okay. Anyone else? So issue of gender very much close to every one of us. Hindi ko pa naririnig. Zeus, any opinion?
Doc, I agree with everything naman with the policies, and according naman sa regarding naman sa mga issues with ano tawag dito, gender inequality, prevalent pa rin ngayon, especially sa mga, for example, ako sports oriented. The one issue is the US football team, women's football team, na they don't get more TV coverage or salary pay, and mas magaling, they have more achievements compared to their men's uh, football
But
team, but their salary is just a third of what men is getting paid for, something like that. So maybe we can, I think we can justify a little because of the airtime that they are still giving to men and the sponsorship being provided by other companies are bigger compared to the female athletes. So it is really political. Also, now we need to change a lot of mindset in our society still worldwide.
well,
Yun po, Doc.
table.
Um,
Yes.
can I add to that?
Yes.
Can I add to this spot? Can I add to that?
Go ahead. Go ahead.
Yeah. Product, the reason behind why they pay more, why they pay the male more salary, even though they have lesser achievement. It's simply because in the game of football, for example, most people watch the men football, the male football. So there are so many crowds, there are so many people, there are so many population in the stadium that is going to generate income. That is going to generate income in which from that income they pay the male. But in the female football, it doesn't generate it. The income that the female football generates is less than 10% of the income that a male football generates. So the government is like, if the female wants us to pay, if the female wants us to pay equal salary that we are paying to the male, where are they going to get the money from? Because the football they are playing does not generate as much income as the male football. So that is actually the reason why the male footballers are paid more, because the soccer for male generates more income than that of the female. So that's the point regarding that.
That goes for any other sport for that matter, because in general, you would see a lot of athletes that we follow are generally males. So I think aside from, for example, gymnastics or figure skating and um, what other sport? Tennis, the other female counterparts would be very far. Actually, even in these sports wherein women are quite well known as well as their male counterparts, they have salary discrepancies as well. So you see, in any endeavor, be it the medical field, be it sports, be it in acting. So even in K-pop or your Hollywood, even your Bollywood, you will see that male actors would have higher salaries than their female counterparts. And I'm sure, Edwin, you will agree again, because you will say that they will generate more income. But
Doc,
yes,
I agree with that.
you
With
yes,
the acting, I do agree with that. That is not right. With the acting is not right. For me, I just generally believe that if you generate more, you should earn more.
you will earn
If you are
more.
generating 1 million, yeah, if you are generating 1 million, they should pay you at least, let's say, 10 to 50% of that 1 million. But if you are generating 500,000, you shouldn't expect to be paid 15% of 1 million when you are generating 500. So you should also be paid 15% of 500. That is equality.
So with the acting, you agree that some females are better at are generate more income but are paid less. Santasila, you want to say something?
Doc, can I say something?
Oh, Rutvik, go ahead.
Doc, yes, this is true that men who are playing football, who they are generating more money. That is why they are paid more. But that is why we are having this discussion. Why people want to watch men who are playing football? Why people are not enjoying? Enjoying women playing the football? That is the reason why we are having this discussion, and that is the reason that is the also the explanation for that there is a inequality. So we cannot just dismiss that thing with that thought that they are not generating enough money. The truth is, it is so rooted in our mind that we as a human being, it is actually it across the world, we don't want to watch them, and it is not just about football, it is truth for the any field. In fact, in India also, India is playing cricket. uh, uh, the captain of Indian male cricket team is yes, that is true, they are generating more money, but the government body, at least they should pay them equal. The body who control the cricket, BCCI, who they paid 1 crore, 1 CR to our Indian captain, and for the same role in the female cricket team, they paid 20 lakhs per year. So that is not the right explanation.
Okay, so again, it is a capitalist-driven world propagated, okay, by the pervasive scenario we're um, in general, males are seen superior with females. Okay. So
Yes,
they are
yes, doc.
better at football, hence more people watch, etc., 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 etc. So that is the pervasive culture, and that is why um, we are having discussion.
Yeah.
Very, very much summarized by Ludwig. Well done. Santasila, you were trying to say something. Your name popped up.
I
Any?
think Doc, in
Yes.
for I have something to add to that. I think in regards to sports, like if the male and the female were to play together, if the male and the female were to play together, that would be a very good justification for everybody to earn equal salary, equal pay, because they are in the same league, they are doing the same thing, and they generate the same revenue. So if the male and the female should play together, that would give a good justification to pay equal salary. But again, what would happen? The female will get dominated in that sport. They will get dominated by the male. It's something about biology. They will dominated by the male in that sport. Even for example, the US female team, the US female team played the US football team, the under 11 football team played the senior female football team, and the under 11 football team of the male won the senior football team of the female by 11 goals. So the thing is, I actually agree that they should increase the salaries of the female with regarding to sports. But then again, where are they going to generate where are they going to generate the revenue from? Because running the government, you have to budget. Running the government, you have to know where to get the source of that money. You have to budget money. So if you are actually taking budget, okay, from generation of this product, we are going to pay this. So if you are saying they should pay this group of people more amount of money, where are they going to generate the revenue from? Should they use the revenue meant for health, or should they use the revenue meant to build infrastructures and then pay these people that are generating lesser revenue? Of course not. So you have to think of revenue generation in regarding to allocation of salaries and others.
So, for example, for movies,
That's it. Doc.
there's a couple, male and female actor, um, headlining a certain movie. They both are famous, but male actor gets more of the share than your female actor. So is that fair? Is that gender equality, equity for you?
And for the movie, that is wrong because they are both doing the same thing. They should be paid equal amount of money.
Okay. So in sports or in any, uh, is there a sport that is gender neutral, wherein there would be no male or female categories, and as you have described, they are allowed to participate in one competition? Is there?
Okay. No, I don't even think that is possible because if that becomes possible, the female will be out of place. They can't compete with the same level as the male. Biologically, we are
Precisely.
faster, we are stronger, and all that.
And that's why we are having this discussion, because anatomically, yes, we are, it is such that we
We
have
are not equal.
different roles. And as you have been arguing for the past arguments, um, by anatomy, your male is perceived to be superior than your female counterparts. Hence, policy was put into place to more or less equalize that, because males, in general, not all, tend to be the dominant gender when it comes to any field. Okay? So that is why even in politics, even in the family, sports, etc., etc., policies have been put into place to more or less equalize this disadvantage just because of gender. But again, as we have mentioned, there are outliers. There are women who excel, but that is more often seldom than it occurs. Okay. So even in politics, for example, in Philippine politics, we will say that, oh, Philippines has an open mind because um, they have had women presidents to, for that matter, in the form of Gloria Macapagal Arroyo and Corazon Aquino. Okay, but we fail to see that they were there in the first place because of their um, relationship with the husband who was assassinated and the father who was a former president. Not discrediting the merits of both politicians, it is still more their relationship with their significant male counterparts are more of a factor than their own credentials. I mean, okay, and that goes for any other endeavor more often than not. Okay, so um, that is what that is why, despite all the advancements of technology and despite all discussions regarding equality and equity, still bottom line is women more often than not, especially in the lower class, are at a disadvantage in general. And I'm not saying it's not all. It's getting better. It's getting better. More women have the opportunity to have access to education. And that is because of awareness of the women as their right. And again, awareness of your male counterparts who recognize that it is not to be superior or inferior to the other gender, but more or less strive for equality. We will never be equals. Okay? Much as we try to achieve equality, structurally, as I've mentioned, our biology dictates that we are different and would have different roles. Okay? Males could never get pregnant. Your females could never impregnate someone else. And it takes a male and a female to do that biologically. Okay? So, but we
Doc,
have, yes, Ludwig.
yes, Doc, from last half an hour, we are talking about money, but what about the unpaid work? I am from India and I can't speak for the whole world, but in general, Indian women put in many more hours of unpaid work than men. So that is also the reality. We uh, when it's come to the when you are paying for something, then the men are supposed to get better, but when things come to the like to handle your child, handle your family, doing your daily activities, uh, according to one survey, in India, women generally spend 350 minutes a day for unpaid work, and in the comparison, men does only 25 minutes. So so that so that is also a big inequality.
Okay. Anyone else? Edwin, anything you want to add before we wrap up?
Mm, I would just say, every country should try as much as possible to evaluate the situations in their country and come up with a policy to help the situation in that country, not generally by looking like not by generalizing it by saying may have more advantage or female have more advantage, because in some countries female has more advantage, like in the Western world they give priority to the female, they have more privileges than the male. So in let's say in my country, like in Africa for example, most of the female they don't work. If you don't have money as a man, if you don't have money to live up as a man, they won't even give you attention. So you as a man, you have to work hard, you have to make money, and you have to give to your wife to live the kind of life that she wish to live. So it generally depends on the country, the religion, or the location. So I think when given policies, it should be addressed to that particular country and not just making it a general statement like uh, may are benefiting more than females. No, it
Why do
shouldn't be
you
like
think
that. It should
that's
just
so?
be
Why
that
do you think there
with
are
regard to that
policies?
country.
Why do you think in that place that there are policies like that? That what you've mentioned, that women in your country, um what did you say, if they have no job, etc., etc., they would get support, etc.?
I said the no, no. What I said, like from my country, for example, the female they do get jobs and all that, but they don't usually assist in the family, like in providing for the kids and all that. It's only the men that does that. We believe that our women should not have to stress themselves. Women take it upon ourselves to work hard and provide for our wife and provide for our kids. So even the female that work, they don't even bring out their money to assist the family. They keep their money to themselves. It's just the male that brings that money to give the female to live the kind of life they wish to live. So this is just based on location, religions, and all that. So it should be addressed. It should be addressed according to what is happening in that country. Because let's say, for example, in the Western world, whereby a man will work hard, all in the name of marriage. He will have to share 50% of his asset. Should I ask if that is right? All in the name of a marriage contract. Your wife will divorce, even if your wife was the one that cheated on you. It doesn't matter. They will divide your property by half. Is that the if we are saying, if we are talking about gender inequality, so are we like to ask, is that fair or is that right? And some we can see some cases whereby in this Western world, the male, if they have issue with their wife, they send them out of their own house. You will lose your house, you will become homeless. So if we are trying to address an issue, we should generally address what is happening in that particular country. With the things that are happening, we should address it and create policies for that particular country, and not just making a general statement that men are treated more than the female, or the female are treated more than the male. Because in some countries the female are treated better, in some countries the male are treated better. So my point is that we should face it according to what is happening in that particular country, and not just making a general statement about it. As they do.
As I've mentioned, Edwin, and that is why we had this discussion. There are outliers, and I'm happy that your country is like that. But in general, I told you that you say that I will not make general, but that is why we have this discussion. Out of 100%, 90 to 95%, etc., would have these experiences, be it in India, the Philippines, and any other country, most of that women are at a disadvantage. And it's good that some countries would have women would have a better opportunities, but that is not the case for all. Hence our discussion for this afternoon. Okay, but thank you for the inputs of this is a very uh, interesting discussion, a lot of inputs from you. This is what we aim to have every time, discourse that listens, and that we could hear your opinions, we could hear your culture and learn about more about your thoughts as well, and how your mind processes things. So we aim to develop your critical thinking um, as well as your medical judgment, more than your medical judgment as far as this clinical rotation is concerned. All right. Any questions? Violent reactions for this today's discussion?
No more, Doc. For the ending, Doc, the world is just pushing equality po, Doc, in terms of the rights of an individual po, Doc, regardless of the gender naman po.
Yes.
So that's what I want to partake to ourselves naman.
All right. So this ends our discussion for today. Um, Thurs on Thursday, we would discuss on reproductive health. One would one local clerks could report on reproductive health of the Philippines. Um, September batch to rotate out. We're still with us this week. Um, please report on the state of reproductive health in India. Okay. For the interns, divide yourselves into two and choose your reproductive health issues um, that is prevalent in the Philippines. There you could choose cases of abortion and family planning as a means to start discussion. And for the Indians March batch, I would request you to report on your therapeutic policies, policies on therapeutic abortion. Okay. We have an African, you could um, mention in passing your reproductive health policies as well and your policies on abortion if there is any. Okay? So that would be your assignment for Thursday. Any questions?
Doc, hello po, Doc.
Yes, John Paul.
Yes, Doc. For the clerks po, Doc, ito na po yung last day ng current batch po ng clerks. May next rotator na po for Thursday.
May sige, ano na lang. Interns, one would report on reproductive health, the other would report on the issues of repro health in the Philippines. So last day nyo na ngayon?
Yes po, Doc. Yes, po.
Alright. Okay. Please tell them to contact me or Dr. San or contact me for for further instructions for the new rotators. Okay?
Yes po, Doc. I will po.
Okay, so if there are no more questions, you may leave this call. Thank you and see you on Thursday.
Thank you po.